Temporomandibular joint dysfunction, or TMJD, can be distracting and debilitating. Common problems involve jaw pain, clicking, locking open, locking closed, headaches, and more. In an expose on 60 Minutes, John Stossel pointed out how many expensive yet ineffective treatments there are. Ultimately, they recommended inexpensive treatments like massage, especially in the beginning. The TMJ is commonly referred to as the most complex joint in the body. It hinges as the jaw starts to open and glides as it opens further. The disc between the mandible's condyle and the temporal bone surface facilitates the hinging and gliding. The joint is supported by a complex sling of muscles that allow the jaw to open, close, move side to side, jut, retract, and perform rotary chewing. Clicking and locking occur when the disc has trouble moving with the condyle. When the condyle skips over the edge of the disc, it clicks. When the condyle is stuck in front or behind the disc, it locks the jaw open or closed. In the early to moderate stages, the pain comes from the trigger points in the muscle. In more advanced conditions, exposed nerves are compressed, the pain is severe, and different approaches are more appropriate. In my 20s, I had severe TMJ problems and was hospitalized with migraines. Also, I had unresolvable tooth pain. I didn't get relief until I found a neuromuscular massage therapist who treated my neck and jaw. In my 30s, I wrote a manual for treating trigger points that had an extensive section on TMJD. As an exercise in class, we had students sit up straight, lightly touch their teeth, and notice how their bite changes as they rotated their heads around in a circle. Try it. You can easily see how your upper neck impacts your bite. Craniostructural techniques were gentler and even more effective in balancing and stabilizing the jaw and upper neck. After cranial work, trigger point therapies were quicker, less painful, and had longer lasting results. Typically, there was no need to treat the trigger points at all. Sometimes they would release with just some gentle stretching. Additionally, there are self-care posts to help with exercises, stretching, and to tell you which activities to avoid or change. Integrative craniosacral with gentle trigger point work is a proven approach for TMJD. This is Tony Preston. You can reach me at integrativeworks@gmail.com.